Hello, I'm Amanda Williams, the Senior Team Leader at Charlton Farm Children's Hospice South West and lead nurse for the project. Today, we're going to be talking to you about the Starling Service, a new end-of-life care at home pilot service for babies, children and young people in the Bristol, North Somerset and South Gloucestershire area. We'll cover a brief background of the project, the expected benefits, our service offer and how to refer alongside contact details for our project leads if you have any further questions. The Starling Service is a collaboration between 4 palliative care providers and the ICB. Before we begin, I'd like to introduce you to our partner leads.
Hi, my name's Emma Heckford and I'm the Medical Director at Charlton Farm Children's Hospice.
Hi, I'm Sarah Jones, Head of Nursing for the Lifetime Service, which is part of Sirona Care and Health.
Hi, my name's Jadine Davies. I'm a paediatric oncology outreach nurse specialist at the Bristol Children's Hospital.
Hi, I'm Katie Owen and I'm a nurse at Children's Hospice South West. I'm currently supporting the lead nurse for the service as a team leader.
Hi, I'm Bethan Nicholas and I'm the lead nurse for paediatric palliative care and bereavement support at UHBW.
Hello, my name's Claire Matson and I'm the nursing care lead at Jessie May.
There are currently 4 children's palliative care providers in BNSSG. Children's Hospice South West are a charity. Their base in Bristol is Charlton Farm Children's Hospice. Charlton Farm currently provides telephone, virtual, in-house and some community support for all the families on its caseload, as well as responding to urgent requests for symptom control, end-of-life and after-death care. The hospice provision for end-of-life care is in-house currently. Sirona Care and Health provide the Lifetime Service. This is the statutory community children's nursing and psychology service for children with life-limiting and life-threatening conditions. Jessie May are a charity who provide nursing and respite care in a family's home for children who have a life-limiting condition. And University Hospitals Bristol and Weston, also known as UHBW, provide hospital-based and community nursing and medical support through their dedicated team of hospital specialists. The 2 main teams of note here are the Hospital Paediatric Palliative Care team, whose provision currently is for inpatients only, and the Speciality CNS teams, some of whom can provide community support within working hours. Until now, children have usually received end-of-life care in the hospice or in hospital, and home end-of-life care has not been a realistic choice for most families. The main reason for this has been that no single provider has had the workforce or the capacity to provide the required medical and nursing care 24/7 to safely support babies, children and young people at home at the end of life. Our goal has been to create a system that delivers end-of-life care at home in a sustainable and equitable way, hence the development of the Starling Service. So we requested data from the BNSSG Child Death Overview Panel on the number of children and young people who died and were registered with a BNSSG GP between the 1st of April 2018 and the 31st of March 2021. As shown in figure 1, 5 of the 102 children or young people, i.e. 5%, who died over this period died at home. Based on a clinical review, we estimate that 52 of those 102 children or young people could have been offered end-of-life care at home over this period. Further research has shown that where children and families are offered home, hospital or hospice as a location of choice, approximately 1/3 of children and families would have chosen home. Now I'm going to hand you back to Amanda to talk about our engagement and collaborative work so far.
Bereaved families have engaged with the project team through a series of psychologically led interviews. The aim of these interviews was to understand each family's views and feelings on receiving end-of-life care for their child. Findings from these interviews showed that being at home was important to families, alongside the context of flexibility and choice. A lived experience representative, Julie Kembry, a bereaved parent herself, sits on the programme board and is an integral member of the project's engagement and evaluation group. Ongoing engagement will take place with the children and families who receive support from the Starling Service through informal questions and check-ins and more structured interviews for those families who are able to engage in this way. Now I'm going to hand you over to Sarah Jones, who's going to talk about the benefits of the service and the eligibility criteria.
The expected benefits of the Starling Service include an increase in the skills and confidence of the current palliative care workforce via an increased training offer and a collaborative working with colleagues across the system, providing greater equity of access to end-of-life care at home for children, young people and their families, and to bring this in line with the care at home offer available to adults. An improvement in the quality of end-of-life care, with staff across providers working as a single team around the child and family, providing more personalised and responsive support, which meets the NICE guidance and delivers the national specification for children's palliative and end-of-care services, improvement of hospital and hospital flow while improving choice available to children, young people and families, and laying the foundations for further work to integrate children and young people's palliative and end-of-life care and bereavement support. The Starling Service is for babies, children and young people aged 0 to 17 years old. They have to be registered with a BNSSG GP, and they have to be considered to be within the last 2 weeks of life. The baby, child or young person does not need to have had a life-limiting or life-threatening illness recognised prior to this episode of care. The baby, child or young person does not need to be previously known to paediatric palliative care providers, and they must be assessed as clinically suitable for end-of-life care at home. Please could you discuss the referral with the team before entering any discussions with the child and family. Every effort will be made to work collaboratively to restore any barriers to enable children and families who wish to receive end-of-life care at home to be supported to achieve this. And now I'm going to hand you over to Jadine Davies from the UHBW Oncology team, who is going to talk about the Starling Service offer.
The service is an individual, personalised offer based on a child and family's needs and preferences, with an understanding that these may change over time. The Starling Service offer includes specialist palliative care nurses providing 24/7 cover via a nursing rota. As a minimum, each child will be reviewed twice a week in person by the medical team. More frequent medical reviews will be available if indicated. Medical advice and support available 24/7 from a specialist palliative care paediatrician, either virtually or in person. Supply and support of administration of any prescribed medication, including infusions of medication, through symptom management planning, clinical reviews, and access to telephone advice. Coordination of supply of any clinical equipment or consumables required by the child at home. Support in the hours, days following the child's death. The Starling Service will remain involved for up to 2 weeks following a child's death at home. During this time, staff will work with the family to identify the most appropriate bereavement services to provide ongoing support. Now I'm going to hand you over to Katie Owing from Charlton Farm, who is going to talk about how to refer and some of the constraints of the service.
The Starling Service will aim to deliver end-of-life care at home for up to 2 children. In the event of a third referral being received, the team will consider if they have the capacity to accept the referral. The location of care may change for 2 reasons. Firstly, the child or family may change their wishes of the location of care. The service will ensure this journey is fluid and enable them to move care between hospice and home. The location of care may also change if the service capacity is reached. This may be due to a change in the child's clinical needs or unsustainable workforce pressures. Alternative locations of care will be offered and arranged by the service. This will be clearly communicated with the families. The service is time limited. Match funding is only available until the 31st of March 2024. Referral acceptance will stop 3 weeks before the end of the pilot. We will ensure families are supported and informed of any constraints this may have on their referral. Managing a family's expectations can be a challenge, especially for families that are used to each organisation's usual care offer. Clear communication and a unified approach will aim to ensure families feel listened to and supported. And finally, the service's future viability. The whole pilot will be evaluated, and we aim to demonstrate the service's needs and its benefits. All future funding options will be explored. It is really important to make sure consent is obtained from the family before proceeding with the initial referral. This consent can be verbal. Once this referral is agreed in principle, a family consent form will be shared. The consent forms will be available for use on Children's Hospice South West's website. They can be completed in advance or completed over the phone with a senior member of the team. This slide shows the clear pathway of referral once the criteria for referral is met and consent is gained. Any professional involved in the child's care can make a referral. Referrals can be made by calling Charlton Farm on the number shown between the hours of 9 AM to 5 PM. Please ask to speak to the lead nurse or doctor for the Starling Service. Inquiries can be made out of hours on the same number, and these will be followed up on the next working day. The team will aim to meet as soon as possible to discuss the referral and plan the child's care at home. This will be communicated with the family. In the event a referral cannot be met, the reasoning for this will be shared and further options for care will be explored. I'll now hand you over to Beth and Nicholas from UHBW, who will talk about our launch event and how to find out more.
We have an in-person launch event coming up. This will be held at the Education Centre at UHBW on Monday, the 5th of June in the early evening. We welcome you to come along to hear more about the work of the Starling Service, engage with a range of palliative care professionals and ask any questions you have about the service and the future plans. If you would like to receive an invite, please contact the project manager, Rebecca Benson, using the email above. We hope to see you there. If you would like to find out more about the service or have any questions you'd like to talk through individually, please do contact one of our project leads using the contact details shown.
We have listed some commonly asked questions about the service. To confirm, any professional involved with the child's care can refer into the Starling Service. Nurses will not be in the home 24/7. They will routinely visit once a day and will be available 24/7 to provide advice and support by telephone, video call, or for additional visits to the home as needed. Ongoing support from the speciality team is welcomed. The Starling Service will lead on delivery of the end-of-life phase, but will do so in strong partnership with any speciality teams or other providers of support to the child and family. Thank you for listening today, and we hope to see you at our launch event in June.